I would like to introduce myself. My name is Stewart, Greathouse. I was raised here in Lake Charles and have been with the Memorial Medical Group now for the past year and am practicing up in Moss Bluff, Louisiana. And we're going to talk today about how to get the most out of your doctor's visit. Most of the things that we're going to mention today are not earth-shattering. They're not things that you've never heard before. A lot of them we may think of as common sense things, but there are hopefully some things that maybe you haven't thought of before. Hopefully these are some reminders. And what I'd like to do is give you a little bit of a glimpse into how we as doctors approach the visit too, so you can understand the things that we're trying to accomplish so we can meet together and make the most out of the visit so you can get everything done that you need to, and we can leave the end of the doctor's visit accomplishing everything that we need to and really being able to make strides and have a profitable visit where everybody walks away happy and satisfied. And that's really kind of what this is geared towards, and that's our goal. So we're going to go ahead and get started. There are actually a couple of things that we're going to talk about, but we're going to kind of break them up into things that I think are important to do before your visit, so before you ever come to the doctor, things that you're going to be focused on doing when you're at the visit, when you're actually in the office talking to the doctor and talking to the nurses, and things that you do immediately after your visit. And so we're going to put this in that timeline and go from there. So we're going to start with the things that we do before your visit. This is before you ever actually show up at the doctor's office. And we're going to talk about these four things very briefly, and some important things that you need to do under each of these topics. First one that we're going to talk about is knowing your history. The second one is knowing your medication. The third one, writing down your questions. And the fourth one, keeping a diary. All four important things that you can be doing before you ever even show up at the office. Let's look at the first one here. Before your visit, you need to know your history. Now, when we say history in a medical sense, we're thinking of some important things. First one is going to be any medical conditions that you have or have had. Okay? Now, this can be things like diabetes, high blood pressure. It can be hospitalizations. It will be things like important diagnoses that you may have had when you were younger and you are not currently being treated for, but you were treated for in the past. Some folks may have had a chronic illness that they were treated for and it's gone, it's resolved now, you're no longer being treated for it, but that's all part of your medical history. And knowing those things are very important. When we think about those things, another thing that is helpful for us as doctors to know is if you know about how long you've had that condition. So if you have high blood pressure, it's helpful to know that you were diagnosed around 2000 or 15 years ago or 20 years ago. That kind of gives us a little bit of a timeline because based on how long you've had a condition, sometimes we will make decisions on how aggressively we're going to treat or other tests that we may do to look at things and make sure that we're not missing anything. So how long you've had a condition is important. What I encourage most people to do when talking with your medical conditions is write these down beforehand. A few folks, you may only have one or two problems, and that's great. You know them right off the top of your head, and that's not bad at all. A lot of us, by the time we get 3 or 4 or 5 things that we have had or been treated for or are being treated for, it gets difficult to remember all the details that go in with that. What I encourage my patients to do is actually write those things down, write down about how long you've had them off to the side, and carry that piece of paper with you. Carry it in your purse, carry it in your wallet. Some folks who are very tech savvy like to have that on their phone if you have one of the new fancy smartphones or something like that. And that's fine, but keep it somewhere on you, and that way you don't have to necessarily remember to pick up that sheet of paper when you're leaving to go to the doctor's office. You've already got it written right there, and it's already going to be in your purse or in your wallet or with your medication bag, someplace that you will see it and remember to bring it. Knowing your surgeries or procedures that you've had in the past is also another very important part of your history. With surgeries and procedures, we're talking about any type of surgery. So if you've had your gallbladder taken out, if you've had your appendix out, if you've had a hysterectomy, if you've had simple things like a colonoscopy or an endoscopy, a scoped look into your stomach, all of those things are very important for us as we begin to look at where we're at in the visit and what kind of things we need to be looking for down the road. So know those things, and if possible, as with your medical conditions, write down the date that you had those procedures. Okay? And for the ones that have been recent, it's often very helpful for me and for us as doctors to know who did that procedure. Okay? If you had a colonoscopy, which doctor did that procedure? If I get 6 months down the road and all of a sudden I begin to have questions and say, well, maybe we need to do another colonoscopy, it's a lot easier for me to be able to look at your chart and say, oh, well, they already told me that it was Dr. Smith down the road who did their colonoscopy. I'll just go ahead and give Dr. Smith a call instead of going through the trouble of having to call you and get that information. And it sometimes helps us to be able to get things done more efficiently and more quickly without having an extended period of waiting to get all that information together. So knowing what procedures or surgeries you've had, when you had them done, and who did them is very, very helpful for us. Another important part of your history is your allergies. Okay? With allergies, the most important thing for us as a medical professional is knowing what your reaction was to the drug or to the substance that you had the allergy to. Okay? If it's latex, we need to know if you broke out in hives, if you started itching. If it was a particular medication, we need to know if it just caused upset stomach or if it caused you to have tongue swelling or facial swelling, or if you caused a severe reaction and you had to go to the emergency room and be put into the hospital and watched overnight. There are certain things when we look at medications from a medical standpoint, there are severe allergic reactions that can be life-threatening, but then sometimes there are just very bad side effects. And knowing what your reaction was to a medication helps us determine if it was a very bad side effect of that medication or if you had a true allergic reaction to that medication. Those two things help us make a determination on if down the road we ever get into a place where we have very few options for treatment. If it was just a very bad side effect, sometimes we can do things to alleviate that side effect and still use that medication if we absolutely have to, instead of maybe using another medication that's much more risky. But if you had a serious allergic reaction, then we need to know that, because that helps us to know that we need to stay away from that medication and anything related to that medication to prevent a further reaction like that. So if you're able to remember the reaction that you had to a medication, that kind of helps us vary that out and decide if it was more of a side effect or a serious reaction. Now, I understand a lot of folks have reactions you may not realize. I see a lot of people in the office and they say, Doc, I'm allergic to penicillin. I don't know what happened. My mom just told me they gave it to me when I was a kid and I almost died. And that's okay. But just let us know that. Okay? Next thing that's going to be important for us is family history. When we talk about family history, the things that are most important to me as a doctor to know is particularly the family history of your mother and your father and your brothers and your sisters. Okay? Grandparents can add that's extra information, aunts and uncles, that's all good information, but the most important thing for me is your brothers and sisters, your mother, and your father. Okay? And the things that are specifically important is knowing if any of them have any cancer and what type, if any of them have heart disease, and about how old they were when they first had their heart problems and what kind of heart problems they had. And then, of course, any inherited disease or disorder. Those are always very important. But those are things that are particularly important for us when it comes to family history. For cancer, for instance, if you have a family member who had colon cancer when they were in their 40s, perhaps a brother or a sister, a mother or father, that means when you come into the office, I'm going to say, well, we need to look a lot earlier for colon cancer than we normally would. And so that type of history is very, very important to us. So particularly cancer, heart disease, and then the other things that we mentioned like inherited disorders. So those things are really important to know. And like I said, mother and father, brothers and sisters particularly. Extra history on top of that is great. Any information you give us can be helpful, but those are the things that I would really make a point to know and to have written down so you don't forget it. Okay? All right. So the next big point. So you need to know your history, but you need to also know your medications. All right, a couple of quick things we're going to mention here. First of all, you need to bring your actual bottles of your medication or bring a list to every visit. Okay? I'll tell you right now that I am not a pharmacist, so I'm not very good at knowing what the little white pill is or what the blue round one is or the one that has 504 written on it. And there are pharmacists who know that stuff and they're very good at it. And if you were to show up here in the hospital and you can't answer those questions, I can send those medicines down to the pharmacist and they can actually tell me what they are. But if you show up in the office and I'm having to figure it out based on those descriptions, I'm not going to be able to do it. So that's why it's really important for you to actually bring the bottles or bring a very detailed list. The things that are very important for us on the list is the name of the medication, and then the dosage, meaning the size of the tablet that you're taking. Is it a 35 milligram tablet? Is it a 1 gram tablet? Is it a liquid? If it's a liquid, do you take a full teaspoon? Do you take half a teaspoon? Do you take 5 cc's or 5 milliliters? All those things are important. And then also knowing the frequency. How often do you take this? Do you take it just when you need it? Do you take it every day at 6 o'clock in the morning? Are you taking it twice a day, 3 times a day? Those things are very important. So make sure if you're writing down your list, you include those facts. The name of the medicine, the size of the dose, which may be a pill or a tablet or a liquid, and then how often you're taking those things. Okay? Something else in relationship to this is when you're going to see several different doctors, oftentimes you may have a doctor that prescribes that particular medication for you, and while another doctor prescribes 4 or 5 other medications for you. If you have doctors prescribing different medications for you, please jot their name down next to those medications. So when you go to see the heart doctor and your family doctor is taking care of all of your medications and he's the one who's normally refilling those medicines, if your heart doctor thinks he needs to adjust your blood pressure medicine based on something that he saw in a recent test, he can adjust that, but then he can also call your family doctor and say, I know you're normally prescribing this medication for them, but I changed it based on what I saw. So the next time, if you refill it, it needs to be at this dose. So writing those things down, if you have several different doctors prescribing your medications, will help do away with some of the confusion that we sometimes see when a specialist or maybe the family doctor changes a medication and your other doctors may not know about that right off the bat. Okay? And then lastly, if you're taking over-the-counter medications regularly, please let us know. If you're taking herbal supplements, if you're taking extra vitamin D and calcium, if you're taking B12, if you're taking ginkgo biloba or chondroitin or any of those supplements, just let us know. Every once in a while, for instance, I'll do a test result and I'll look and someone's calcium is high. And I'll get a little worried. Say, oh no, their calcium's high. It could be this, and it could be this, and it could be this. And so I start thinking about all the things we need to do, and I go back and look at their lab work from last time, and then I get concerned, and I call the patient, and they're like, oh, well, I guess I shouldn't be taking 4 extra calcium tablets every day. No. So, but when you tell us those things at the beginning, we can put that in your chart and we know. So if stuff like that comes up, it's helpful for us and kind of prevents confusion down the road. So you need to know your history, know your medications, but before you ever come to the doctor, you need to write down your questions. And this is a big one that's very, very important. What I encourage people to do is write them down, actually write them on paper, type them out, something. Okay? It doesn't have to be legible by anyone but you, because you can sit there and you can read it, but if you write it down, you won't forget. Write down your questions, and I encourage people to try to limit it to the 3 most important questions that you have, 2 or 3. And the reason for that, all of you have been to the doctor's office and have had to wait in the lobby for half an hour, hour and a half, 4 hours, something like that, okay? And that's very frustrating for everybody. Sometimes, not always, sometimes part of the reason that happens is that in our scheduling, we allot a certain amount of time for us to see everybody that we need to see. And someone may come in and they may have a problem that's much more complex or much more involved than we initially thought. And that takes extra time, and that pushes everybody else back. Because if there's something very concerning going on, we can't just ignore it and tell them to come back next week. We have to deal with it while you're there. So writing these things down and limiting it to the most 2 or 3 important allows us to address the most important things and helps me as a doctor and helps your doctor be able to balance the time that we have in the visit. Okay? So like I mentioned at the very beginning, our ultimate goal is for you to be able to leave the visit having your questions answered and having things addressed that you want addressed. But there's also things that the doctor is watching for that he's keeping close track on, and he wants to be able to make sure we have those things done. And so limiting your questions to the 2 or 3 most important are going to help him balance that time and get everything done that we need to. I'm going to be very honest with you. If you come in and you have 15 questions for your doctor, the doctor's going to have a very hard time answering any of those adequately. It's just very difficult to do. We have a set amount of time and we're trying to accomplish what we can in that time so we can see the next patient we have. And we want to devote all the time that we have in that period to get things done. And it's hard to do that if we're trying to answer 15 questions, and what's going to happen is that we're not going to answer all of them adequately. And so what we want to do is we want to know what the most important questions are that you have. Tell us those, and we'll address them. And if you have more, let us know, and we'll try to get you back in and schedule you for a follow-up appointment a little bit sooner. Or maybe the nurse will let you leave the questions there, and the doctor can look at them and have the nurse get back in touch with you. But prioritize those things and write them down. That allows us to get everything done that we need to in the visit and actually take care of what we need to for you and for us. With the questions, once again, I kind of alluded to this already. Be brief. Funny story, this happens to me more often than you would imagine. Someone will have a question, and I said, Doc, I have a question. I say, okay, what's your question? Please tell me what it is. And this is how it starts. Well, 35 years ago. Okay. And then it will go for 15 minutes. And then they'll ask the question. And I don't mind that. But the problem is it takes 10 or 15 minutes for us to get to the question. So once again, what that does is that you take 10 or 15 minutes and then you leave the doctor with 3 minutes to try to answer the question and do his exam and take care of what may actually be a very serious and important thing. So try to keep those brief if you can. Sometimes there's just a lot of information that has to be said, and we understand that. But if you can be brief, try to be brief. That way we have time to do the things that we need to after your question to adequately address it. Next thing, ask the doctor early in the visit. Okay? And this can be nothing more than walking in. The doc walks in and says, "Hey, Miss Smith, how are you doing today? It's good to see you. Has everything been going well?" You can say, "Doc, it's been going well, but I have 3 questions to ask you, or I have 2 questions to ask you." Just let him know right off the bat. Now, he may ask you right then, what are your questions? He may ask you a little bit later on in the visit what those questions are, but if I'm your doctor and I know that you have 2 or 3 questions to ask me, in the back of my mind, I'm going to make sure we have time set aside in the visit to take care of those questions. So ask them early, or let the doctor know early that you have those questions. It's very difficult for a doctor to address your concerns when he's gone through and done everything that he thinks needs to be done, and he thinks we've gotten everything done that we need in the visit, and he gets up to leave, and then you say, "Oh, Doc, I have 2 questions." Okay? We don't mind answering the questions, but now we've already spent all the time that we had planned on doing those things, and we're left with time here, not as much time as we'd like to truly address the questions that you have. And like I mentioned before, sometimes those questions are pretty serious things, and we really need to take some time to look at something on a physical exam, or to order some tests, or to even do some things there in the office that we need to before you leave. So asking them early in the visit will help us make sure we address those things in a timely fashion, and that way you're not rushed and we're not rushed in trying to take care of that. And when that happens, there's less chance of things being missed. And then lastly, if you've already done research, if you've talked to your friends, if you've looked up in books, or if you've looked on the internet, or if you've seen TV commercials specifically about what you have questions on, tell your doctor right off the bat. Okay? Let us know. So, Doc, I saw this new medicine. One of my questions is about a medicine. I saw this new medicine on television, and they tell me if I take it, I'm going to die next week. And I looked at my medicine, and I'm taking this medicine. Okay? But tell your doctor if you're worried, and tell him why you're worried. And if you've done some research or reading, tell him already where you've done that. Some resources are very good. There are some excellent places and sources of research, sources of information, like the American Heart Association, and WebMD is an online or internet resource that's very good. But let us know if you've already done that research, because that helps us know exactly where you're coming from and what your concerns may be. Okay? And then lastly, before your visit, a very important thing is keep a diary or a log. And this is very important for folks who have chronic conditions. This is going to apply a lot to folks who have high blood pressure or diabetes. Okay? If you have high blood pressure, many doctors would like for you to check your blood pressure occasionally and let them know what your blood pressure is when you're not in the doctor's office, when you're at home. And sometimes this may be nothing more than checking your blood pressure once a week or once every 2 weeks. Sometimes your doctor may want you to check your blood pressure 4 or 5 times a week, or even every day. And depending on what they're asking you for, when you do check that, write it down. Okay? What I have learned is I consider myself still relatively young, not real young, but relatively young. I don't remember most of the stuff I'm supposed to, even now. So I'm having to write myself notes and jot these things down. When you check your blood pressure, write it down. Put the date. This was the date, 8/26/2015. It was 135/77. And if you check it next week, jot the date down and keep that with your medication or in your purse somewhere where you'll have it to bring into the doctor. If you're a diabetic, your blood sugar readings are also very important. You can do the same thing. Jot those numbers down and bring them into your doctor. That's super helpful information for us. That really helps us make the best decisions that we can about your care. So keep those things in a diary or a log, a notebook, anything like that. Every once in a while, someone will come in and you'll have a chronic problem that you're going to see the doctor for. Sometimes it's headaches. I've seen folks in my clinic say, Doc, I've had a headache for the past 3 months every day. And you know what I'll tell them to do sometimes? I said, well, this is what I want you to do. Go home for the next 4 weeks, and I want you to write down every time you have a headache. I want you to write where it hurts, what time of the day it is, if you take anything for it, and if it gets better. And that helps me a lot in being able to ferret out if this is a dangerous headache, if it's not a dangerous headache, how we need to approach this and treat it, and different things that we can do. And so for some chronic conditions, some folks will have chronic stomach problems, maybe diarrhea or maybe upset stomach. If this is happening on a regular basis, just start jotting those things down. And your doctor is going to be amazed when you walk in and you say, see, Doc, this is what's been happening. And he can take that and look through it, and all of a sudden we have a lot of information that we wouldn't have otherwise, and really helps us make a good decision and the best decision that we can in trying to get to the bottom of things quicker. Okay? So before your visit, know your history, know your medications, write your questions down, and keep a diary or a log. All right. Now, during your visit, a couple quick things. Ask your questions early in the visit. We alluded to this already. Be honest. Update your doctor on recent changes and ask questions about your condition or treatment. All right. So, we alluded to this already. Once again, ask your questions early in the visit when you have them. The doctors will not feel rushed to answer them if you ask them early. This may affect what your doctor looks at or the test that he orders, and this allows the doctor, once again, to balance your concerns with his in a timely manner so we can accomplish everything that we really need to do. So we're going to move on from this since we talked about that a lot already. Secondly, be honest. And I stand up here and I say this and I realize that I really don't think any of my patients are ever purposefully dishonest. Okay? But sometimes you may be embarrassed about a mistake you made. And I see this. You woke up yesterday before your doctor's visit and you realize, I've been taking 2 of these and I was only supposed to take 1. And you're a little embarrassed about it. So you don't want to tell your doctor. It's okay. It really is. I don't fuss at patients for that. Your doctor's not going to be upset. We just want to know. Okay? Because if you come in and one of the numbers on your blood work is a lot different from what we would expect it to, or your blood sugar is all of a sudden much different from what it has been, or your blood pressure is much different from what it has been. If there was a mistake, if there was something that you did that you didn't realize you did, please let us know. Just be honest and upfront with us. We're not here to say, oh, you're a terrible person because you forgot, or you're a terrible person because you did this. No. We forget things too all the time, and we have a whole office full of staff that help us remember, and we still forget things. So we understand that. But please let us know and be honest and upfront with that at the beginning. The last thing that we want to do is we don't want to make a change to your medication based on what we think is happening when something else is happening. Does that make sense? If we think you're taking this medicine once a day and you really haven't taken it for the past 3 weeks, if we all of a sudden double that dose of that medicine and you decide that, well, I'm going to start taking it now, we could actually put you in trouble. You can actually have some pretty significant side effects. So be truthful and honest about that stuff up front, okay? If you are purposefully dishonest, like I said, I don't think that happens very often, but that does destroy some trust that your doctor has in you. So please, just let us know if there's mistakes, if there's something that happened, upfront and truthful with us from the very beginning. All right. Update your doctor on any recent changes that you've had. If you've been in the hospital recently, please let us know. Not all doctors will come see you in the hospital. Different doctors have different practice styles, so your primary doctor, your family doctor, may just be the doctor that you see in clinic. And so he may not have even realized that you went to the hospital. If you did, make sure you know that. And if you have any copies of paperwork, of papers that you got from the emergency room, anything like that, please bring those with you when you come to your doctor's visit. And when you're at that place, if you were in the hospital or if you were at the emergency room, ask them to send a copy of your results to your doctor. Sometimes that gets done, sometimes it doesn't, but there's a lot greater chance of it happening if you specifically ask for it. And that'll help your doctor out tremendously. Okay. If you had any recent labs or tests or procedures done, you may not have the results from those, but just let your doctor know. Say, Dr. Greathouse, since I was in here last time, I had a colonoscopy done, and Dr. Smith did it up the road. And so you may not have the results, but I can call Dr. Smith or call his office and say, hey, would you mind sending over the copy of that colonoscopy that you did? And they'll send it over, and we'll have those things in your chart. And that way, the doctors that you see have a complete medical record of what's been happening. And then recent doctor's visits with other physicians and changes that they made during the visit, please let your doctor know if your medication was changed from when they saw you the last time. And we referenced this earlier when we talked about how the heart doctor may change a medicine and that your family doctor normally prescribes, or vice versa. Make sure that you let the doctor know if anyone changed any dosages of your medication, and they'll go over that, and that'll help them to know what's going on and, once again, not to make mistakes. And then lastly, if you're taking any new prescriptions or over-the-counter medications, and that kind of goes with the other one there. All right. And then during your visit, ask questions about your treatment or condition. Okay? Don't be afraid to ask questions. Do not be afraid to ask questions. Most doctors would rather you ask the question to us then than go home with questions and end up either taking your medication incorrectly or worrying about it for the next week. If you have questions, please ask us. Okay? If there's a new medication, ask the doctor before you leave and say, Doctor, okay, I'm supposed to take this. It's going to be one pill and I take it twice a day, right? And he'll say, yes, that's correct. Or he'll say, oh no, I'm sorry. We may have misunderstood. It's only one pill and you only take it once a day. Clarify those things before you ever leave the office, before you ever leave. Okay? If there are alternatives, sometimes there's an alternative treatment, and the doctor may be discussing with you what he would like to do. And he said, well, we need to probably go ahead and do surgery here. If you really don't like to have surgery, or if you've had a very bad reaction to anesthesia or something in the past, you can ask your doctor and tell him, say, Doctor, is there an alternative? Is there something different we can do? Many conditions or diseases that we have, there's more than one choice, especially early on in the disease. We can say, well, we can do this or we can do this. And one may be slightly better than the other, but if you really have concerns about maybe the doctor's first option, there may be another alternative. And most doctors will work with you on that, and you can come to an agreement about what's best for you and your situation. Okay? I had a patient the other day who had an infection, and they needed to go probably into the hospital to have IV antibiotics for several days. The patient doesn't have any transportation back and forth to the hospital, couldn't get there. And so he told me, he said, Doctor, is there another way that we can do this? And what we ended up doing is getting him set up with antibiotics at home. And we were able to do that, but because he told me early on in the visit that, Doctor, I don't think that's going to work. Is there another alternative? Is there something else we can do? And a lot of times there is. Sometimes there's not, but you'll never know unless you ask. Other possible diagnoses, this is another important question to ask. If the doctor says, we're going to do this test, but this is what we're looking at, and you think, is there something else? Ask the doctor. Say, Doc, is there something else that this could be? I know we think that it's this, but what about, I heard this on the television that with these symptoms, that this might be part of the problem. Ask those questions. If nothing else, it lets the doctor either explain his reasoning, and it helps and puts you at ease maybe a little bit better, so you're not worrying about those things for the next several days or weeks. And then lastly, ask them if there's any changes that you need to make to your lifestyle. Doc, do I need to be exercising more? Do I need to change what I'm eating? I'm going to bed every night at midnight. Is that good or bad? Do I need to go to bed earlier? Ask them about those things, and they'll be sure to let you know if there's something that they think that you need to do differently. All right, and then lastly, after your visit, and we're going to be closing here shortly, after your visit, there's just a few important things that I would encourage you to do, okay? And these, when I say after your visit, this is like immediately after your visit, within the first 5 minutes to the next couple days, okay? When you walk out of the room and you're leaving to check out, please be sure to schedule your follow-up appointment before you ever leave the office. No doctor, I think, is going to be upset if you have to later call and reschedule that appointment, okay? But what happens oftentimes is that we have very good intentions and say, well, I don't know what my schedule is. I need to come back in 6 months, but I might be out of town. I'm not sure what's going to be happening. I'll call you next week and I'll let you know, and we can schedule it then. And most of us forget. So if you can schedule a visit when you're there at the doctor's office, tell the receptionist or whoever's checking you out, say, well, we'll schedule it, but I may have to change it or I may have to reschedule. And if there's an issue with that, they'll tell you, but we would much rather you schedule an appointment and have to reschedule later than not schedule one at all. Next,
Always call your doctor back if your medications are unreasonably expensive. Okay? And this is a very important one, especially for many of us who are on fixed incomes. I had a patient come in the other day, and the doctor who he had seen had inadvertently, well, not inadvertently, he had prescribed him a medication which was very good for his condition, but the gentleman did not have any kind of prescription coverage on his medication. This was someone who I thought did, and I didn't realize this would have been a problem for him. And he was paying $400 a month for 2 medicines. And there was an alternative that he could have gotten for $10 a month, which was almost the same. And both medications were good, and had he had insurance coverage, the one that the original doctor prescribed him probably would have been cheaper, would have been $3 or $4. But it wasn't. And so he went ahead and he bought the medication and spent $400 for those 2 pills that month, and then came in to see me. And so we changed some things up. But most of us, as physicians, do not want you to pay an exorbitant amount of money for your medication. They taught us in medical school, one of those little pearls of wisdom they gave us is that if your patient doesn't like the medicine, they're not going to like you. And there's some truth to that. And nobody out there likes paying $300 a month for a medicine. And so sometimes that's the only option we have, okay? Especially with certain chemotherapy agents or other things for cancer, or if you have a condition that's very difficult to treat, sometimes there just aren't very many options. But many times, there are other options out there. And there are other ways to get medications a little bit more reasonable or a little cheaper. And if the doctor can't switch you, sometimes they can put you in touch with people who can help you with either patient assistance and getting your medications a lot cheaper, or other ways to get those medications. In fact, we had a gentleman this week who called and let us know. He said, I'm on this blood thinner, and it's way too expensive. And so we talked to the drug rep who was keeping us informed about the medication. He said, well, go ahead. This is where you go online. There's an application you can download. Have him fill it out. You have to sign it, and we'll send it off, and he'll probably qualify. And it looks like he will, and he'll get his medications for a $300 medication for very little, $5 or $10 a month. Okay? So there are options like that, but if you never call the doctor and let them know, they may not be able to help you with that. Okay? And then lastly, don't be afraid to call the doctor's office to check on lab results, referrals, or test results. I tell all of my patients who come in to see me, I say, please give us at least a week to 10 days, week and a half, to get back with you about test results or lab results. So after you've had that lab drawn, after you've had that test done, give us 7 to 10 days, because it takes a little while for us to sometimes get that back, and it will make it through the office. But if you haven't heard from us in 7 to 10 days, this is what I tell my patients, please call the office. That's our safety mechanism to make sure that we didn't lose things. As high-tech as we are in the medical community, things still get lost. Sometimes we order a lab result, and the lab will order everything except one thing, and we forgot about it, or we didn't see it, and then we shows up and we see some of the other lab results, but we don't see that one, and those things get missed. So if you don't hear about a lab result from the office, or you don't hear about a test result, don't be afraid to call and just leave a message with the nurse. Say, this is Mrs. Smith. I was just calling about my lab results. I was wondering if you could have the nurse or the doctor give me a call back and let me know. And that helps us to make sure that things don't get missed. We work very, very hard in the medical community to set up fail-safes so we don't miss anything. But no one is perfect. And you become part of that safety net for yourself when you call back the office and say, I haven't heard anything. Could you please check on this stuff? And the same thing goes for referrals. Referrals, I'll be honest, sometimes take a little bit longer because it's 2 doctors' offices. One doctor's office is slow enough. If you put 2 together, it's twice as slow. So it might take a little while to get that done, but you should still hear something within a week or 2. And if you don't hesitate to call. You're not nagging, you're just reminding us. Okay? Now, if you call 4 times the day after your test result was done, it may not have gotten to our office yet, and we just really may not have had a chance to look at it. But don't be afraid to call if you're concerned. So, in review, very quickly, there's things that you do before your visit, things that you do during your visit, and these few quick things that you do after your visit. All of these things will help you as a patient to get the most out of your doctor's visit. They'll help the doctor to accomplish the things that he needs to during your health visit, so you can get everything that we need done and accomplished in the appropriate amount of time, and we can both leave satisfied that we're taking care of everything that we need to take care of. Okay. Are there any questions at all at this point?